Hello everyone, and thank you for joining us for today's webinar. I'm Marta, and here with me is my colleague Igor.
Hi guys.
We will have a special user story today about how nonprofits joined forces to map out entire Liberia and bring clean water to every single person. We would like to introduce Darrel Larson. Hi Darrel.
Hey everybody.
Darrel is International Director for Soy Products, a water filter company, and he is also founder of the Give Clean Water initiative. He will talk about this project he co-organized with the Last Well nonprofit organization, which is still in process in Liberia. So we've prepared the presentation and we'll go through this agenda. You will hear about the origins of the project as well as the challenges nonprofits faced initially before they found a solution and mapping applications. Then you will hear about the life cycle of the project, what were the stages of data collection, how did they assess existing water resources, the follow-ups they made, and what kind of data they gathered, how they made analysis, and how did they make decisions. You will also see a live demo of the project. We will show you one map which has intersected many projects, so you can have a clear overview of the data. And we will also show you one custom form, a survey they conducted throughout entire Liberia. And in the end, you will hear about the results and how these results help them to get fundings.
I just want to add, Darrel will be presenting his use case and how they're using the application. But you can actually post your questions in the panel on the right, I believe. And I'm here to potentially answer some of them.
Yeah, definitely. And you can also ask Darrel whatever you feel like. As well, we will have a quick poll at the end. We want to announce something and ask you a simple question. Also, we just wanted to single out some of the challenges NGOs and nonprofits face when trying to do their projects. So they want to increase the awareness of what they're doing and engage volunteers, and that is often difficult to achieve. They also want to secure funds, but they can't do that without having some kind of data to support what they want to achieve. And they want to easily deliver results to sponsors and donors. So I think this is the moment where we can transfer the screen sharing to Darrel, and he will tell you his story. Darrel, is that okay?
Yeah, that's great. I'm ready for the invite.
Yeah, I'm switching the screen right now.
Okay. And I'll do that. There we go.
Yeah, we can see it.
Awesome. So I wanted to share a little bit about just this journey of what it's been like to go into the country of Liberia. This all started from an organization that's based out of Dallas, actually, called the Last Well. And they had a vision to basically give clean drinking water to the whole country of Liberia. When this organization was first started, they watched this a video, really, called Amazing Grace. And in that video is a story of how slavery ended in Britain. And from that, there was lots of young adults that were a part of the starting of the Last Well. And they began to ask themselves, if something like that could end in the past, you know, something like slavery ending, why couldn't something giant end in our lifetime? And so the Last Well was kind of born out of that. They wanted a big dream. And so they wanted to choose the most challenging place to go. And that ended up being Liberia. Liberia was a country that was plagued with all kinds of things in the past, a civil war that decimated the country. Several years ago, they had an Ebola outbreak. And so it was a very challenging place to go. Liberia was the second poorest country in the world, number 182 out of 183, and just a small amount of per capita income that comes in for the people that live there. And it's also the second most miserable country in the world, which is, I didn't even know that existed, but there's a misery index. And because of all the things like the Civil War and Ebola and those kind of things, that actually ended up being a challenge. And so they looked at what the greatest physical need was there, and that happened to be water. Water was a huge need. There's lots of water in Liberia, but it's all surface water and it's super contaminated. And so, you know, I didn't know these stats, but 250,000 people died in the Civil War in Liberia, and there were 300,000 deaths from waterborne illness since the end of the Civil War, which is just crazy. There's more deaths from waterborne sickness than there was from the Civil War in Liberia. So that was staggering. There were 10,216 deaths from Ebola over the 12 months that were in 3 different countries surrounding that and surrounding Liberia. And up to 100 people a day die from waterborne sickness in Liberia. So water is a giant problem there. So they had chose the place to go. They chose the tool that they would use. And when they first got to Liberia, they really came upon a bunch of people that were working all throughout the country of Liberia on clean water projects and different things like that. And one of the greatest things that the Last Well was able to do was to bring a bunch of NGOs together that were all doing separate things and all doing different things with water around the country, and brought them all together to be partners, and a little bit kind of divided the country up into the 15 counties where everybody would kind of focus on different counties and start the interventions. So they install wells with their well partners, and then they install these clean drinking water filters that we're going to talk about a little bit today. That was kind of where I came into the picture in 2015. Sawyer Products made a donation for the country of Liberia of 100,000 of these clean drinking water filters, which are amazing. We'll show you a little bit about what it does. You can see a picture right here of a dirty water bucket, and this water comes straight out of a dirty, contaminated river in Liberia, and you run that water through this filter, and the filter itself actually removes all the bacteria from any water source and makes purified water right there on the spot. The filter can be reused with a simple back flushing. It can last for years. And so these systems are what are going in all throughout the country of Liberia. And so it's been an amazing process to see that happen. People on the teams, there's been about 150 or so Liberians that have been trained in installation of the filters and in data collection. And so they literally have to go as far as they can drive. Many times they'll get on ferries like this and cross rivers. They can have to cross on canoes. You can see a motorbike there that's inside a canoe. That's how many of the teams cross rivers. And then they hike really as far as they can go into the bush, sometimes 4 to 6 hours that they'll hike all through, you know, all kinds of different bridges that they have to cross in the middle of the jungle in Liberia, all to bring clean drinking water to small little villages like this that really nobody would pay attention to. But they're so committed to doing this. And so that's what's been happening in Liberia, so that little kids like this don't have to die. There are so many young children, especially the 0 to 4-year-olds, that are so susceptible to the waterborne sicknesses that are a part of those rivers and creeks. And so this has been a life-changing experience for the people of Liberia. And thanks to the Last Well and their great efforts in combination with Sawyer, an amazing effort is going on where they're going to be able to give clean drinking water to the whole country. One of the first things that happened for them that was, they would say, was one of the amazing stories was that there was a donor that funded an entire county, the county of Bomi. There's 15 counties in Liberia. And so somebody funded that county and to get them kicked off, which was really, really awesome. You can see Monrovia is right there. That's where the capital of Liberia is. But one of the next big things that happened was actually after data was being used, we'll get into the data in just a minute or so, but the county of Grand Cru actually received a completion letter, a certified completion letter, that the entire county of Grand Cru had border-to-border clean drinking water. And that, to our knowledge, had never been done before. And it was verified through all of the data that we had collected, and the government went in and checked on everything and double checked, and it was true, and they certified that letter. And that was a big game changer for the country of Liberia. Grand Cru is down in the southern part of Liberia, as you can see. So that was a certification process that went through, and the founder of the last well, his name's Todd Phillips. He is amazing, one of the greatest leaders I've ever met. He, you know, he knew that if we can finish a county, we can finish the entire country. And so the dream of the last well to be able to do this and actually execute it and give border-to-border clean water in Liberia was coming true. And that was super exciting for them. One of the biggest game changers that they would say is the data, the ability to collect data, quantify the actual results that happen as a result of installing filters and the life change that comes about as a result of that, and being able to have that analyzed. There's a college that's analyzing all of that data called Calvin College independently, and they're showing all of the benefits of the health changes in the water filters, diarrhea reduction, medical savings, purchased water savings, how many days kids used to miss school, now they don't miss school, how many days adults used to miss work, and how many days after they've received the filter that they miss work. And so they're doing a before and after contrast with that. And it's just been an amazing process to see how that works. I'm gonna show you, this is a screenshot, and we're gonna take you into a little bit of a live demo of one of the maps. What you're looking at right now is a picture of the country of Liberia. I'm gonna switch my screen over to a live shot of this map so you can all see that. And what we have really in front, you can see all of these red dots that are visualized up on the map. I'm gonna clear some of these layers out so you can see them. What happened was that the last well, when they got to Liberia, they had some of the government census data. They needed to know where people lived, and they needed to know what kind of water sources people had, if they had working wells or wells that needed to be repaired, where were the large villages, where were the small villages, all those kind of things. And so as they began to look at the data that was being shared with them, we realized really quickly that that data wasn't very accurate. And we'd go out into a lot of these smaller villages, and you know, the existing data might have said there's 150 homes, and when we got to the village itself, maybe it was, you know, 17 or, you know, something. And so we realized that there was some discrepancies. And so the only way you're going to give clean water to the whole country is if you know where everybody lives. So they literally have teams that ride what are motorcycles, they call them jungle bikes, out into every part of the country of Liberia, and they assess every village. They assess for population size, number of households. They assess if there is a working well in the village, or if there's a well that needs a major rehabilitation or some kind of minor repair. And then they also search and check if there's nothing existing. So what this layer on this map represents is the county assessments that are going on all over the country. Down in the south here, which is where Grand Cru is, you can see there's lots of open spaces in there. That's really thick jungle areas where there's actually not a population. And in some of these other counties on the southeast side, the same thing occurs. People live along water, rivers, those kind of things. So you see that. Then you also see some very heavily populated areas. This is a county called Bong County, where my cursor is. And so all of these assessments, literally, people are driving to every single village. They're using a form that we've created with mobile data collection and filling in the form off the grid. No Wi-Fi or no cell signal is needed. And they're assessing all these counties. Currently, as we speak, the county of Lofa and the county of Nimba, which are really large counties, those are being assessed, and those will be done this year. And so we have teams that are all over. And as you zoom in, you can see each of these red dots represents villages, and as you would keep zooming into all these, you'd actually see the households. We mark every household in the country that receives a clean drinking water filter, which is just amazing. So we have a couple of our older forms that we populated, but one of the cool things that we're able to do is this is a bit of a project map that shows you what's been done in terms of water filters so far. This does not represent all the wells that have been drilled by all the well partners, but this is all the water filters that have been drilled, that have been put in. And as you can see, as you zoom in, the green dots are kind of what we use to track where the installations happen. We have a second layer. When a team goes in, they install the filters on the day of, and they collect a series of data from one of the forms that we have, an installation form. And that's where they get the baseline data of, you know, some basics about the village name, how many people live in the family, how many adults there are, how many children there are, those kind of things. And then we track how many cases of diarrhea exist in the family all through all the ages. We track how much people spend on purchased water, how much they spend on medical costs related to waterborne sickness, and we track the number of school days that kids miss and the number of work days that adults miss. At the 2-week, yeah, go ahead.
Can I ask you, can you tell us how many surveys have you created and completed until today?
You know, I think it's getting close to the 40,000 filters that have been installed. By the end of this year, we're anticipating having 75,000 families that will have these water systems that will have data on all of those by the end of this year. We actually have found out that there's so many extra villages that nobody knew existed. We thought 100,000 filters was going to do it. It turns out that it's probably going to be about 130 to 140,000 of the villages that are going to need those filters, because they're just so tiny and they're in the middle of nowhere that nobody thought or really knew about, but we're going to know that they're there. Wow. So it's pretty profound.
You probably had a few custom forms or surveys created. The first one was assessment, right, of the water sources.
Yeah, so we needed to do the assessment first to find out where all the villages were.
Yeah.
Then we created a installation form that has all the data in it, basically, and all the questions that I was just talking about, as well as other health issues that we track. And then we also have a follow-up form. And in the follow-up form, I'm going to turn that layer on. That is representative of the yellow dots would be when a team goes back after 2 weeks of the follow-up, and they actually go in and give the second assessment, the follow-up assessment, which is a little bit of a compare and contrast. So you have a before survey with the green dots and an after survey with the yellow dots. And then at the 8-week mark, you see the orange dots represent the second follow-up. So we give the same survey again at the 8-week mark, and then we track the before and after results of the reductions in all of those things that we talked about previously. This is kind of a project map that the Last Well uses that shows where all of their filters have been installed. So they work with their teams, and obviously you can see that there's some of the green dots that are getting installations that haven't had their follow-ups yet. Some of the yellow dots that haven't had their second follow-ups, but all the orange dots means that all of those are completed. And then in the midst of these villages, you'll also see there's still some red dots in these clusters, and those would be representative of the larger villages that will actually get well interventions. And so they'll drill wells in those villages, and we have separate maps where we track all the wells that go in. We have a map that we use to track well inspections, so they go back and inspect all those. But everything is very thoroughly done, and if we didn't have a tool like this, I don't think we could do it. It's
what did you do before? How did you create data before mobile data collection, and also how do you create reports from map editor? How do you make analysis of this huge amount of data?
Yeah, so before, just like most nonprofits, people at best might go in with some paper forms, and they would collect surveys on paper forms. They might maybe take a GPS unit out with them, a separate one, and then collect whatever data. Then they would have to bring that. Well, this is what we had to do in the country of Liberia and the country of Fiji, where we're doing this exact same thing. You bring that paper form back into the office, you enter it into an Excel spreadsheet, and just a lot of overlapping, and then you would have to export, and do some table analysis, those kinds of things. What this has done is it's allowed us in real time. That whole process with paper takes a long time. You have people out in the field, sometimes for weeks, and so they're holding on to paper in notebooks. You can imagine 75,000 or 100,000 sheets of paper for installs, follow-ups, all that kind of stuff. It just would be so unwieldy. And now what we're able to do is go out and with tablets or smartphones off the grid, we're able to collect data with these forms, and we come back into a Wi-Fi signal. Our teams would then basically just hit a button on their tablets, and all of the data that they collected would be uploaded to a server. That information could be shared across all kinds of different platforms. So people in Liberia or staff in the United States, or anyone that's helping run the project, can immediately see every single thing that's going on here. And what's amazing is, if you were to zoom in, this is a live map, right? So if you were to zoom in on any of these villages in any of these layers, you could see the information pop right up on the screen, which is really a powerful tool to be able to have that. And so that's basically kind of how we do it. It's saved us paperwork and lots of
Time.
Time. And again, you can analyze this. You can put it into maps. You can visualize it. You can run statistical analysis on it and come out with some really great statistical graphs of what this would look like. And we're just seeing a tremendous life change. What this does is it's the power to quantify these results. So much of the world does really great things with lots of projects like this around the world. And they have great stories. Oh, we installed water filters and it changed this village's life. But these results with this real data allow us to say this many kids are attending school that used to miss school. This many more adults are able to work and earn a living and not miss that income as a result. So you're going to put a form up on the screen, right?
Yeah, I'm just trying to change the presenter. Okay.
Yeah, awesome.
So here you can see mobile data collection application.
Yeah, so this is the app that we would start. We would load and start the mobile data collection app up. And this is what all of our teams actually would see live in the field. We've created all kinds of different forms. This is our filter new Liberia installation form. This is what we use for our initial distribution. And then what you can see is when you choose that form, you get lots of things. So we actually created some barcode filter ID numbers so that we could have an anchor point in our data. And so we stick these little barcodes on every one of our water filters so that we can scan actually with the mobile data collection app. It creates a scan button and it activates the camera on the tablet or the phone, and you can actually go in and scan that number in. So that's there. We have a bunch of different fields. We have our partner organizations that are kind of drop-down lists. Those are all the different teams that are out in the field. Some of our fields are pre-populated, like the country. You can do that with mobile data collection. The counties are interesting because once you choose a county of the 15 counties, you'll see a dependency field that will pop up as a result of that. So with any of these counties, now you're going to be able to choose the district where teams work, and then you can type in the village name, the date that we can populate, and then from there we just have a number of, you'll just see a number of contacts that we have in the village. We have our water source that we track. We have our total adults living at home, medical costs associated with runny stomach, water costs that are associated with runny stomach. We have our children 5 to 17-year-old bracket that we track. Liberians have really big families, so we had to clump this group into a larger cluster. And then we have our children 4 years and under that we track by age, actually. So we track how many kids are in the family, and then we track how many of those kids had runny stomach. We track hospitals, if they had to go to the hospital in the family. We have a bunch of check boxes where we're able to track several things that are related to the water. Runny stomach's not the only thing. We have lots of people that experience coughs and sore throats as a result of the turbidity or the particulates that are in the water and the bacteria that are there that irritate the throat. A lot of those bacteria can cause skin rash and different symptoms. So we're able to track all of those things. And then we have a couple of note fields at the bottom where if there's anything unique, our teams in the field can actually type those unique things in. But that's an example of one of the forms that we were able to create. And I think one of the beauties for me in finding the software, we actually found the software probably I guess in 2012 when we were working in Fiji. We were using paper collection and we needed something that was going to be more streamlined. And I knew of a couple of different solutions out there, but I through some web searching found GIS Cloud and the mobile data collection app, and it was so user-friendly that was like the main thing. We didn't want to have to hire an engineer or something to be able to use this. I'm not an engineer. I wanted something that I could put together and create that was user-friendly and easy to do. And so the combination of that, the ease of use, and some really great customer service allowed us to create these forms. And as you can see on the map, some spectacular results are coming as a result of it.
Yeah, and you just showed us now just one form out of many. Yeah,
we have installation forms, follow-up forms. We track we track inventory of all the water filters in the buckets. We track wells, where the wells go. We track well inspections. Every time somebody goes out and inspects a well, they're able to track that. So yeah, the sky's the limit on what you can do with the software. It's pretty awesome.
Well, yeah, that's the great story. Can you tell us now something about the data? I remember you had specific data on end results, what happened after the installation of water filters.
Yeah, I think we actually have a graph. If you want to share the screen back, then we'll...
Sharing it now.
Okay. And I'll go back into the presentation. So when we first went in, some of their initial data that came back in, we had about 3,000 households. And as you can see, in the initial survey, there were 2,197 households out of that group that had reported cases of runny stomach. After just 2 weeks, that number of frequency was all the way down to 107, which that's about a 95% reduction, which is really, like if you were to ask most people, they would say that was unheard of, that could never happen. But the reality is people are drinking bacteria soup right out of the river, and so they're sick all the time. As a matter of fact, sickness is it's considered normal that you're sick. So imagine what it's like to not have that sickness on that level. You can also see that headaches decreased, and a lot of that had to do with the water tasted terrible that they had to drink, and they weren't drinking enough water to stay hydrated. So when the water's not treated, they don't drink enough and they get headaches. And so that number went way down when they started having really nice, clean water to drink, bacteria-free. The coughs went way down, skin rashes went way down, sore throats went way down, vomiting, all these kind of things that were a part of the intervention. And this is the tip of the iceberg. I'm looking forward to the next big batch of data that's going to be coming out that will be in the tens of thousands of households surveyed. And what we're finding is all around the world, using this tool, we're able to quantify the life change. And as you can imagine, that is a powerful story. It's a powerful story for organizations like The Last Well to be able to tell exactly the life change that's happening in people's lives. And that's great for donors that want to know, more details. We're living in a time now when I think data is becoming one of the most powerful tools that organizations can use for these kind of purposes. And so it's really fun and exciting to see a whole entire country changed. I'll show you a couple of the counties. In 2016, Grand Cru was created. This is just kind of the rest of the project. We have in 2017, 4 more counties were completed. Those are about to be certified right now as completed by the government. In 2018, we'll have a whole nother crop of counties that will be certified completed. That's what the teams are working on right now. The last year, we're going to hit some of those counties on the backside of Liberia, away from the coast, that kind of butt up to Guinea and Sierra Leone. And so you'll see these counties completed. And then in 2020, the capital city, the capital county, Montserrado County, that will be completed there. And they chose to do that last because there's a lot of public works, water department projects that are going on there. That's where the majority of the infrastructure focuses around the capital. And so The Last Well said, hey, we're going to go where nobody goes. And we're going to give clean water to the rest of the population that everybody would have forgotten about. I love this illustration because the Last Well, as they talk about this all the time, and this is the clean water equivalent of the first person breaking the 4-minute mile. Up until the point of Roger Bannister doing this, nobody had ever broke and run a 4-minute mile before. But as soon as he did it, within about 60 days, somebody else did it. And that is what we see. We see the power of, like, if you could do this in Liberia, if you could change the whole country of Liberia, quantify it, have the data to prove it, in the second poorest country, second most miserable country in the world, you can do this anywhere. And that's what I think we're going to see in our lifetime. The strategy's in place, the finish line's in sight, and Liberia is going to be the first developing nation with universal access to clean drinking water. And I think in our lifetime, we're going to see this big, giant killer, which is the #1 killer in the world, is going to disappear in our lifetime. There's lots of things that lots of sicknesses that you can't do anything about. We don't have cures for them, but clean water is not one of them. And we have a great solution, especially with these water filters, where we can give years and years of clean drinking water to people around the world. And so we're super excited about what's going to happen.
Yeah, thank you. That's really an amazing story. And I know that this is not your first project. You've already finished one project with Give Clean Water Initiative a few years ago, right? And you're planning to...
We're still working in the country of Fiji. That was where this all began, though, with an organization I started. As far as my data collection side, we founded Give Clean Water in the country of Fiji in 2008 and have been working there. And we're working on a countrywide effort there. It's a very challenging place. They have just had their 4th cyclone in the last 5 weeks with flooding and all kinds of stuff. And so their rainy seasons are really tough, as they are in Liberia. Lots of challenges there. There's 110 populated islands that are really spread out really far. So there's challenges of getting this water out to those places. But we're working really hard at the same kind of an intervention there with 100,000 filters that will finish the country of Fiji. And yeah, so 2 countries currently on track.
And you're also working with many different nonprofits, right? And you're organizing them and helping them to learn about mobile data collection and the process of gathering the data.
Yeah, that's been a really cool development, because as the word gets out about these countries and their clean water interventions, more and more NGOs are saying, hey, we want to learn how to do this. We want to collect data. We want to be able to tell these great stories. And so we've spent a lot of time working with new nonprofits all around the world. Sawyer currently works in over 80 different countries. And so we have nonprofits coming online. right now as we speak. Some are already using the software, and we have an organization down in Haiti that's actually Haiti and Honduras. They're called Water with Blessings, and they're kind of up and running on that, and they work in several countries. But lots of new ones coming online because they see the power of this. It's a game changer in terms of how nonprofits work around the world.
Yeah, and would you say that apart from gathering the data about the water and water resources, you ended up gathering all kind of data and updating the census data as well? So you kind of mapped out the entire country and gathered a large amount of data that can be used in various situations.
Yeah, so this is going to be great in sharing the data in an open source way with these assessments. The last well is working with the government agencies that are there, and so this will be a powerful thing for them to have actual numbers where somebody really went to the village and counted the population and the number of households and those kind of things, as opposed to sometimes in surveys the terrain is so difficult that sometimes people just ask a neighbor, hey, how many do you think live in that village 4 hours away?
Yeah.
The beauty of this is we go there, and you can see every time we do that survey, it automatically marks the GPS coordinates in that village, so you know we went, and that is a powerful thing.
Yeah. So you have been collecting points. And let me ask you, if mobile data collection enabled collecting lines and polygons, would you be able to use it as well?
Yeah, I think there's some applications. In some of the open source mapping, there's actually, you know, pretty good in some of the villages in Liberia. There's some details of what a village might look like, you know, with huts and, you know, all kinds of stuff like that. There's a lot, you know, I think there's lots of applications where we'd be able to do it, and we're experimenting with some of those ideas right now.
Yeah, because we have an announcement, and I think I will pass to the Igor to tell you what we are developing right now.
Yeah, actually, we wanted to use your great story in this webinar to actually announce the release of line and polygon functionality for the mobile data collection application. I know we've been talking about other use cases, so I'm sure that you'll benefit from that functionality as well. But yeah, we also wanted to find out if some other organizations are interested in that kind of functionality. So we've released a poll, and for those of you who are interested, we can actually include you in our beta testing, and we will probably release this in the next update.
Yeah, in a couple of months. Thank you for participating in our poll. Thank you for joining our webinar, and if you have any questions, we can now answer them. I can see that some participants said hi to Darrel. And also there was a question, what software or application was used to track the form information. So if you weren't clear, so they used mobile data collection application. That is our application for collecting data in the field.
So I wanted to ask you, Darrel, a question. How many people, I'm not sure if you already said that, how many people were collecting the data?
We've trained about 150 people in Liberia that are out there on any given day with installing the filters mostly, and we have our well teams that are out there that are using the data. And so, yeah, I mean, it's a very powerful movement of people that are making their way methodically around the country, and they're all using the mobile data collection app.
And what would you say, how much time is needed for them to, you know, get acquainted with the application?
You know, when we go train people, I've done several trainings in Liberia. We usually train them a day on water filter installation, and then we go out into the field and we practice it, and then we train not quite a day, maybe a half day of classroom training or something like that when you're working with a large group, because we want to walk them through all the elements of it. But it's a pretty quick process to learn how to use it. We spend a little bit more time with their trainers so that they can, you know, learn how to upload everything to the server and manage that and get their maps and things. But the reality of having 150, what I would call lay people, they're not engineers. Many of them don't have college educations. They are just regular people that are using tablets, some of them using tablets for the first time in their life. And the fact that all of that can happen with untrained people, in a sense, that's a testimony to how user-friendly the software is.
Yeah, we need to mention that you can test the application as well. You can create an account like immediately. Just go to our website and you can test it out. You can build a form, see how it works for you guys as well. But obviously, we can also help you out. And like Darrel already said, he's been helping a lot of people and organizations to get on board with mobile data collection application as well. So we can definitely connect you with them as well.
Yeah, I think Darrel told me he organized a conference where 11 different nonprofits joined them.
Yep, that was very recent in February. We had 11, a couple of them, the Last Well was there, Give Clean Water was there, but then there was 9 other organizations that weren't really using the software, and we were able to introduce that to them, and many of those organizations are now coming online to do their own pilot project. We typically set groups up with their own custom form and then their own pilot project and kind of get them going on that. And that can be done, you know, through our contacts, but you can do that directly with GIS Cloud, just like we did. And I can say they'll walk you through every step of the way of how to get that up and running. Really, really good. One of the most important things, and I think it's most impressive, and I don't want to embarrass you guys, but they're really good at customer service. If you send something in, they are going to respond very, very timely and get you the answers you need. And they're always, it's almost like they run so many different companies and organizations, but you'll feel like you're their only client. That's how good they are.
Wow, thank you.
Cool.
Thank you very much.
Yeah.
And we have a last question for you. I think I can read it as well. The Sawyer filter being used in this project focuses on treatment, but doesn't provide a solution for safe storage. Is safe storage an eventual goal as well, given issues with recontamination as it relates to health impact?
Yeah, so we try to train our teams on the ground with a lot of different messaging, wash messaging inside of our app, we actually include some wash messaging on hand washing. We teach them how to clean their containers. We double check on them when we go back on follow-up. We don't just check on the health data, but we actually check and double check on their filters systems, if they're working properly, if they're cleaning them properly. So we give a lot of that messaging in what we're doing. The reality is that you're going to have, you know, in these bush jungle kind of areas, they're not very hygienic in many places. And so we try to teach them to clean all of their stuff and reinforce that wash messaging that is so important for them. But the reality is that we're getting these large reductions in those pretty unsanitary conditions. So the combination of the wash messaging and everything and the training that we're doing, we're really trying to focus on changing behavior. That's why we don't just install water filters and then never go back and see them. We go back and follow up, because a big part of, you can have the best technology in the world, but if you don't reinforce wash messaging of hand washing, cleaning your containers, and you don't clean the filters, the best technology in the world will fall by the wayside unless you actually focus on changing people's behavior.
Yeah.
And so the data actually allows us to track that as well. How many people are actually engaging the water filter training, where we and our follow-ups, we ask a question: was the filter working properly when you arrived at the home for the follow-up? We track the percentage of what that is, so that we can see how effective our training is as far as changing behavior.
Yeah. We actually got a couple of more questions where you were talking. So one attendee is wondering, how reliable is the data regarding the educational background of the data collectors?
Well, we're seeing this on a large scale. So our next rollout is going to be you know, tens of thousands of data pieces. We also have the same thing going on in Fiji, and what we find is a very consistent number If you were to do a normal randomized control trial, you might maybe sample, let's say 1,500 to 1,000 people in Liberia would represent a randomized control trial. We are going to have data so overwhelmingly powerful that you're not going to be able to refute it really because of that. But I personally have been with all these teams in the field on numerous occasions. We're very committed to continuing education of our people in the field. We are very aware of data fatigue in doing so many interventions and those kinds of things. And so we spend a lot of time with continuing education and training with our people that are giving the surveys. And I've actually seen them give the surveys, all the teams. They're amazing at how they give the surveys and how they collect the data. I've watched them, coached them, and their WASH training, their WASH messaging, the way they use the tablets, the way they do the surveys is really, really impressive.
And if I can add from the technical point, I guess the option to actually control what kind of data comes in is also really important. For example, if you need a number of certain currencies or something like that, the only thing they could add or input is that number, right? Or maybe a select of predefined values. So we've actually learned, not just with you, but with a lot of other organizations, that having predefined values that kind of required fields, let's say, improve data quality by margin.
Yeah, we have learned a lot of those lessons along the way from the early days of using the data in the field. And we've created some pretty robust dependencies in our forms that actually cut down dramatically on human error. And so we've spent a lot of time refining those forms, and we have them in a really good place right now where you just normal input of human error is very minimized because of the robust nature that you're able to create the forms. And so that's been a bit of a learning curve as we've gone along, but that has helped us have even more reliability in the data.
Yeah. There's also a question about the population of Liberia. Do you know maybe the total number of people, and how are you able to give every home clean water, as well as what kind of data you collected? There is a list of questions like just households and wells. What about roads, other water sources, other infrastructure, schools, clinics, etc.?
Yeah, so the last well is focusing on homes, not as much schools and clinics, if you will. There's other countries like the Fiji effort actually includes both of those in the effort, but there's about 4 million estimated, as best the government can tell, about 4 million people that live in Liberia. And so the way we know we go to every place is that we have those guys out marking and doing those assessments, going to every single village. I know part of the campaign at the end, they're going to do a lot of radio advertising and different things like that. Radio is still a big thing in Liberia. And so as we go and make our way through, the government actually is certifying that the work is done, certifying that the villages have had their clean water interventions, and that's what these letters are doing. They're actually double checking and verifying that the work is accurate. And then they'll do a campaign and make sure that, if there's a lone village or something that's out there, we think we're coming upon them. But if there was such a thing, that through the campaign, that they would make sure that they got clean drinking water as the project winds down in 2020.
Yeah, so all this data is becoming official government data, and is it able, can you use it open source, and can other organizations as well use this data?
As the last well, I mean, I'm not, I don't run the last well, but they're the ones that have contact, with the government, and they work closely with them and the Ministry of Public Works. And so I know that their plan is to use this as open source so that they can benefit from population sizes, they can benefit from water source information that's in there. They'll know where all the wells are. They'll know that all the wells, that were existing and working. They'll know the ones that have been repaired. They'll know where everybody got water filters, all those kind of things. And so that will be super useful to the Public Works Department, I'm sure, Again, I don't have contact with the Public Works Department, but the Last Will does all of those things.
There's also a question about internet coverage. So how do you obtain GPS data of remote villages without having mobile data collection connected to the internet?
Yeah, it's a great question. So inside of all the tablets and the phones, there actually is an independent GPS chip that's built into the tablets. And so it does not require, it's almost like the same thing as having a Garmin or a Magellan or some kind of a GPS unit. That those chips now come in smartphones and tablets. And so you're able to grab GPS signal just by your tablet talking to the satellites without having to be attached to a cell phone or a Wi-Fi grid.
Mm-hmm. And
which is the power of it, because there's no cell signal in a lot of those places, or Wi-Fi. So we couldn't do what we do unless that was a feature.
Yeah, and if you need to use some data you previously collected on your mobile phones, you can just download the data before and go through them even offline, right?
Mm-hmm.
Yeah.
Yeah, so you have access to all those. You can actually see the maps that we create inside the app. There's a layer project section of the app, and then there's also a maps and layers section. So we can assign the maps to the teams too, and they can have all that same the same mapping and everything that we looked at on the screen.
Mm-hmm. Okay, well, I think this is the last question we can go through. It's a bit long. So how is this work being done in collaboration with the Liberian MOH? I'm not sure how to pronounce this. And
Ministry of Health.
Yeah, and other government bodies for managing water infrastructure systems. Is there a transition plan for Liberia to take this over? What does that plan look like?
Yeah, so those would be some questions more that the Last Well would be able to answer most fully. I know that they're working hand in hand with the Public Works Department, and they are the ones in charge of water, and they are in charge of the water intervention. So that's already in place. And I should note that this project already is being done by Liberians. It's not being run. We're organizing on a certain level, myself, a few people with the Last Well, but the project is being run and done in Liberia by Liberians. And so there's well teams and well maintenance teams that will spring up and have small businesses that will run. We're trying to do the same kind of things with water filter distributors and those kind of things that will be a part of Liberian-based small businesses that will spring up to be able to service these things over the long term. So in general, there are very few what I would say people, from America or whatever that are actually hands-on doing the project. We're equipping, building capacity in the local Liberian culture, and they are the ones that are running the project, which that's a kind of a core value for all of us as we do that, because we don't want to be, I know for the Last Well and for Give Clean Water, there's a couple ways you can do projects. You can do projects to somebody where you go in and it's all us and we're doing it to them or whatever. But those projects don't work and they don't sustain. When you do projects with them, that's fundamentally different. And so we're really all about building capacity in the local Liberian structure and partnering with the local people there and government agencies on the ground so that this can be a long-term sustainable solution.
Yeah.
And it's great to see that the technology is here to help you create that bond, to help them feel empowered actually.
Yeah.
Yeah, well, thank you, Darrel, for this amazing story and how your explanation of the whole process. It is very an extensive project, which I think is now going on for several years. And I know that you will be spreading all that you have learned across entire globe, actually.
Yeah.
Do you want to add anything else?
No, I just thanks for the opportunity to share it. It's one of the most amazing projects I've been involved with, and I get to again be involved in a couple different countries and now lots of countries that are unfolding. But I'm excited to see where it's going to go. I'm excited. The countdown's on. This last week, I think we're at 998 days until December 31st of 2020, somewhere around there. we cracked in under the 1,000 days that we have left to reach this goal. And so it's exciting to think that in a very short amount of time, those years are going to come really quickly, that that whole country is going to have this water intervention. So that's going to be awesome.
I guess we'll need to do another webinar to show more results.
Definitely.
Yeah.
This is
We'll show the finish line.
Okay, so thank you everyone once again for participating, and if you want to try the mobile data collection or our other solutions, just sign up or contact us. You can contact Darrel as well if you have a project similar to his. So thank you.
Thank you, Darrel. Thank you, guys.
You're welcome. Thanks, you guys.